In this episode, you'll discover the specific practices real survivors use to accelerate their healing and learn the science behind why these methods work across almost every chronic and terminal illness. You've been told it's incurable, but here at Renegade Remission, we believe in rewriting the story. If you're facing a terminal or chronic illness, you are not alone. I'm Eleni Welch, certified nutritionist, and each week I share healing strategies and remission stories to help you take control of your health, feel better, and rediscover hope. Welcome back to Renegade Remission. By the end of this episode, you'll understand why nervous system regulation is a core part of long-term healing, learn which practices survivors turned to again and again to shift out of survival mode, and hear a remarkable story of someone whose healing began when their nervous system switched out of fight or flight into rest and repair. Stay until the end for a detailed step-by-step guide to 4 survivor-backed nervous system practices you can begin today, even if your energy is limited. Your nervous system is the control center for inflammation, digestion, immunity, hormones, sleep, detoxification, and cellular repair. When it is dysregulated, healing stalls. When it is calm and active, healing becomes possible. A well-known example of how the nervous system and emotional state can influence the experience of illness comes from journalist Norman Cousins, whose story is documented in his memoir, Anatomy of an Illness. In the 1960s, Cousins developed a severe connective tissue disease that was diagnosed as ankylosing spondylitis. The condition caused intense pain, inflammation, and progressive loss of mobility. According to his account, the disease advanced to the point where even small movements became extremely painful, and he struggled to move his neck, arms, and joints. His physicians informed him that the condition could be progressive and disabling. Cousins later wrote that the diagnosis and the uncertainty surrounding it created a powerful emotional impact. While researching his illness, he became interested in emerging research suggesting that emotional states and stress might influence physiological processes in the body. He began exploring whether changing his emotional environment might influence how his body responded to the disease. Cousins arranged to leave the hospital and stay in a nearby hotel where he could control his environment more easily. There, he experimented with approaches intended to support relaxation and positive emotional experiences. One of the practices he describes in his memoir involved deliberately watching comedic films and television programs that made him laugh. He reported that periods of sustained laughter allowed him to experience temporary relief from pain. Over time, he combined these practices with high doses of vitamin C and continued medical supervision from his physician, Dr. William Hitzig. Cousins reported gradual improvements in his symptoms, including increased mobility and reduced pain. In his memoir, he describes eventually regaining the ability to return to work and resume many of his normal activities. His story later attracted widespread attention because he published an account of his experience in the New England Journal of Medicine in 1976, where he described his illness and recovery from the perspective of a patient. Researchers and physicians have since cited his case in discussions of how emotional states, stress physiology, and the nervous system can influence the experience of illness. Cousins states that his periods of sustained laughter cultivated positive emotional states that may have helped support his body during recovery. Stories like Norman Cousins raise an important question. How could something as simple as laughter or emotional relief influence the course of a serious illness? To understand that, we need to look at what happens inside the nervous system when the body moves out of stress and into states of safety and restoration. When people living with chronic illness begin focusing on calming their nervous system, they are not simply relaxing. They are influencing biological systems that regulate inflammation, immune coordination, digestion, sleep, and cellular repair. Researchers across neuroscience, immunology, and behavioral medicine have identified several mechanisms that help explain why nervous system regulation can influence healing potential. Let's explore 3 of the most important ones. The first is that chronic stress keeps the body in threat mode. When the brain perceives danger, it activates the sympathetic nervous system, which is the fight or flight response. This response prepares the body to respond quickly to immediate threats by increasing heart rate, tightening muscles, heightening vigilance, slowing digestion, and releasing stress hormones such as cortisol and adrenaline. These changes are extremely helpful during short-term danger. However, when the nervous system remains in this activated state for long periods of time, the body continues allocating energy towards survival rather than repair. Psychophysiology researcher Julian Thayer has shown that heart rate variability, a marker of autonomic nervous system flexibility, is strongly associated with health outcomes. Lower heart rate variability often reflects a nervous system that is stuck in chronic threat mode and has been linked with poorer outcomes in many chronic diseases. When the nervous system becomes more regulated and flexible, the body gains greater access to restorative processes. The second mechanism is the vagus nerve, which helps regulate inflammation. One of the most important pathways connecting the nervous system and the immune system involves the vagus nerve. Research by neuroscientist Kevin Tracy identified what is now called the inflammatory reflex. This neural pathway allows signals traveling through the vagus nerve to influence immune activity and inflammatory cytokine production. When vagal activity increases, immune cells may reduce the production of certain inflammatory signaling molecules, including tumor necrosis factor and other cytokines involved in inflammatory cascades. This mechanism helps explain why practices that activate the parasympathetic nervous system, such as breathing exercises, meditation, and social connection, are associated with improvements in stress physiology and inflammatory balance. The third mechanism is that safety signals reopen biological repair pathways. Key insights come from the work of neuroscientist Stephen Porges, who proposed that the nervous system continuously scans the environment for cues of safety or danger through a process called neuroception. When the brain perceives danger, it prioritizes survival physiology. Blood flow is directed towards muscles, digestion slows, immune activity shifts, and the body prepares for defensive action. When the brain perceives safety, the nervous system shifts towards parasympathetic regulation. In this state, digestion improves, sleep becomes more restorative, inflammation may stabilize, and the body regains access to processes associated with repair and recovery. This means that learning how to generate signals of safety, even briefly, can influence how the body allocates its biological resources. In simple terms, your biology changes when your brain believes you are safe. Across survivor interviews, remission research, and clinical stress regulation programs, several practices appear repeatedly. These practices are not extreme or complicated. Most are simple ways of helping the nervous system experience safety, connection, and regulation. So as promised, here are the practices survivors use to calm their nervous system. The first is somatic downshifting. Many survivors describe learning to shift their attention away from racing thoughts and back into physical sensation. Examples include pressing the feet firmly into the floor, noticing the weight of the body in a chair, feeling the texture of a blanket, or placing a warm hand over the abdomen while breathing slowly. Somatic grounding interrupts cycles of catastrophic thinking and sends sensory signals to the brain that the body is safe and in the present moment. Research on somatic-based therapies suggests that focusing on physical sensation can reduce stress hormone activity and improve autonomic nervous system balance. The second strategy is co-regulation through connection. One of the most powerful regulators of the nervous system is connection with another person. Developmental psychologist Ruth Feldman has shown that humans regulate each other's physiology through voice tone, facial expression, and presence. This process, known as co-regulation, influences hormones such as oxytocin and can reduce stress responses. Many survivors describe moments when sitting with someone who felt safe, a partner, a friend, therapist, spiritual advisor, or support group, helped their nervous system settle more than any technique they practiced alone. Connection is an essential biological signal of safety. The third strategy is guided imagery, linked to physical sensation. Guided imagery has been studied extensively in pain management and oncology support programs. Unlike positive affirmations, effective imagery, often focuses on physical sensation. Patients might imagine warm sunlight softening areas of tightness, visualize breath moving through areas of discomfort, or picture circulation flowing through tense muscles. Research led by nurse scientist Kristen Quickbone has shown that targeted imagery practices can reduce pain, improve relaxation, and help patients cope with symptoms treatment. These practices work by shifting the nervous system away from threat signaling and towards calm, focused attention. Just a few episodes back, I walked you through a brief, guided meditation that emphasized this exact type of effective imagery, focusing on physical sensation. Be sure to go back and listen to that episode and return to it again and again whenever you need a guided healing meditation. The fourth strategy is bilateral stimulation. Some survivors have discovered calming effects from bilateral stimulation techniques derived from eye movement desensitization and reprocessing therapy. Simple versions of this practice include tapping alternating sides of the body, such as tapping the left and the right shoulders, or walking while paying attention to alternating footfalls. Neuroimaging studies of EMDR suggest that bilateral stimulation can help reduce fear responses and assist the brain in processing distressing experiences more effectively. And the fifth strategy is micro moments of positive emotion. Many survivors describe small moments of joy or appreciation that help interrupt the constant stress of illness. These moments might include watching the sunrise, listening to music, laughing briefly, feeling fresh air on the skin or grass under your feet, or noticing something beautiful in nature. Psychologist Barbara Fredrickson has shown that even brief positive emotions broaden attention and build psychological resilience over time. These small emotional shifts may help the nervous system spend less time in threat mode and more time in states that support recovery. Small, consistent system shifts like these compound over time. To engage in a 3-point somatic grounding technique, press your feet firmly into the floor until you feel their shape and weight. Place one hand on your chest and one on your belly, and say to yourself, right now in this moment, I am here, I am safe enough. Do this for 60 seconds to reduce nervous system activation immediately. To engage in co-regulation, choose one person whose voice or presence feels calming. This could be a friend, therapist, pastor, spouse, or even someone who has passed. Just recalling their voice can actually activate safety pathways. Call them, sit beside them, or listen to a voice recording. To engage in a 2-minute bilateral reset, tap your right shoulder, then left, alternating rhythmically. Tap slowly for 2 minutes while breathing gently. This helps integrate fear responses and settle the amygdala. Give yourself a micro-dose of joy today. Choose one moment from 10 seconds to 2 minutes of something that brings even a tiny spark of warmth. Stand by a moving body of water, smell fresh air, listen to a favorite song, or watch something that makes you smile. These small moments accumulate, and they are quiet medicine for the nervous system. Remember, your body is doing exactly what it needs to do each day to adapt and protect itself. So we simply need to engage in practices that encourage it to protect us in gentler ways. In upcoming episodes, we'll continue discussing strategies that improve our healing outcomes. So stay tuned for those episodes, and as always, go be renegades.